Like many researchers across the country, my research came to a pause during COVID to reduce the risk of transmission by bringing people onto the hospital site that didn't need to come in. It was very safe for my research participants for my research to pause, so we did. Lots of other studies continued because they were therapeutic trials and there would be more risk to the patients if those studies stopped, but mine specifically paused. So I wanted to use my skills elsewhere across the hospital where they were needed. So in collaboration with Occupational Health, we set up a clinic to invite staff members to have their antibodies tested to whether they've been exposed to COVID-19. Whilst they were coming to clinic, we asked them whether they'd be happy to take part in Cambridge Bioresource, which 6,000 staff members said they were happy to do that. And what that meant is that we were able to answer some of the questions that were flying around the media, but also just to the general hospital leaders and managers as to which staff groups were at most risk. What was it about those staff members that meant they were most at risk? Was it their ethnicities? Was it where they worked? Was it both? So that information helped us to protect our staff in the future. So our staff members are risk assessed based on all of those criteria, and sometimes they might be asked to shield, or sometimes they might be offered a different deployment to keep them safe. And ultimately, if we can protect the staff, we can protect the patients as well. So that's the wonderful thing about performing COVID research, is that you get answers. And the Cambridge Bioresource is collecting data every single day to try and protect the public and staff against COVID-19. So that was my role, my main role during the first wave. I've also used my research skills to help with the COVID vaccine trials, and that was in the form of data entry, consenting to research trials, and also taking bloods before or after people having their vaccine. And it's been a wonderful opportunity for me to be working with the research nurses in a lovely team environment, and I couldn't have wished for a better environment to be working during COVID, which sounds kind of strange when you think about working in a hospital. It was really difficult, but with the people around you make it so much easier.